In this video, we will discuss about convalescent plasma therapy of SARS-CoV-2, the basic principle behind this plasma therapy of SARS-CoV-2, and some of the assays related to SARS-CoV-2 or COVID-19. So let us start with convalescent plasma therapy. So whenever whenever a person is recovered with SARS-CoV-2, it developed antibody against SARS-CoV-2, and this is represented by here. These antibodies can bind to SARS-CoV-2 and prevents the infection of SARS-CoV-2 within the patient. And these antibodies, when from the person that is recovered from the SARS-CoV-2 can be used or can be utilized to treat the person that is still positive for SARS-CoV-2. So this can be done with the help of plasma therapy. That is, plasma from the patient that is recovered from the SARS-CoV-2 can be used to treat the person that is still the COVID-19 positive. So the plasma that is taken from the recovered patient will first go through an assay where the functional activity against the SARS-CoV-2 of the plasma is been tested, and then it has been used for the treatment of uh, uh, COVID-19 positive patient. And when this patient has been recovered, then antibodies against SARS-CoV-2 are being generated within his body, and this uh, and his or the patient's plasma can then further be used to treat another COVID-19 positive patient, and this cycle will continue. And this graph explains the time period during which, if plasma is been given to the COVID-19 positive patient, will be very much effective. So when here is the week -2 where patient is exposed to SARS-CoV-2, and initially, as we know, that there are no symptoms or very less symptoms are being observed when a person is initially exposed with SARS-CoV-2 in most of the cases. And after week 2, the symptoms are begin to observe, or we can say symptoms begin to show within the COVID-19 positive patient. And this green line in the graph represent the viral load of the SARS-CoV-2. So after almost 1.5 weeks, the immune system of the body recognize this foreign substance and start generating the antibodies. IMM is the first antibody that has been generated by human body, and uh, that act against foreign particles. And then after some time, this IgG is generated that will boost the immune system of the host or the infected patient. However, we can see that there is a time lag between antibody generation and the onset of the symptom. So if plasma has been injected in this time period, then it will not only boost the immune system of the patient, but also helps in reducing the viral load in a much less time in a much less time. And the detail about this is been presented in this paper, whose reference is there in this slide and also in the description. So here are the assays that are some of the assays that are related to COVID-19. First one is to detect anti-SARS-CoV-2 antibodies are present within a patient or not. And this can be detected, and this is known as indirect ELISA test. And what happens in that is the first microbial plate is been coated with antigen that is specific to SARS antibodies against SARS-CoV-2. That is antibodies. It will only the antibodies against SARS-CoV-2 will be able to bind to this antigen. So when the patient antibodies will run through this plate, and if the anti-SARS-CoV-2 antibodies are present, they will bind to this plate. After that, the secondary antibody will pass through the plate that can only bind to the anti-SARS-CoV-2 antibodies, and it also contains some fluorescence in it. And after that, in the final step, there is an enzymatic conversion of the substrate occurs on the secondary antibody that generates measurable change in color, which can be observed by eyes. So, if there is change in color, uh, change in color is observable, or change in color is been observed, then we can say that antibodies against SARS-CoV-2 are being present within this patient. Second one is about the sandwich ELISA for detecting SARS-CoV-2 antigen, whether the person has SARS-CoV-2 or not. For this, it is a sandwich ELISA. The antibodies against SARS-CoV-2 antigen are being plated, are being coated on a microbial plate, and after that, the viral antigen present in the patient are being passed through this plate, and the SARS-CoV-2 antigen will bind to the SARS-CoV-2 antibodies, SARS-CoV-2 antibodies, anti-SARS-CoV-2 antibodies, and after that, a secondary antibody will pass through it. Secondary antibody will pass through the plate, so they which will also contain some fluorescence in it, and if viral load contains a SARS-CoV-2 antigen, then then only the secondary antibody will be able to bind to this antigen. Otherwise, with the absence of this antigen, the secondary antibody will also not be able to bind to this, and thus there will not be any enzymatic conversion occurs because of the absence of secondary antibody, and there will be no change color. However, the picture that shown here is that antigen is present in the viral antigen in patient, and it is bind to the anti-SARS-CoV-2 antibodies, and the secondary antibody also binds to the other part of the antigen, SARS-CoV-2 antigen, and the enzymatic conversion of substrate generates measurable color change. Then it has been confirmed that uh, viral antigen of the patient that has been used in this assay contains SARS-CoV-2 antigens. And third one is the serological diagnostic test for COVID-19 antibodies. So it is based on lateral flow assay setup, just like people used for pregnancy test. And here is the plate where result will be shown, and first one is the control valve where it will ensure that the instrument is working. This control valve will always light up, or changing color in control valve always occur. And second one is the testing valve. It will show the result of the uh, sample. Third one is the conjugate pad. It will contains all the conjugate antibodies that are present in the that is required for this assay. And the last one is the sample well where sample is injected. So the first step is to inject the sample, and the second step is buffer loading. What buffer loading does is buffer loading ensure that all the samples and conjugate pad will flow through this plate. So here is the sample incubation. After that, COVID-19 gold COVID-19 antigen conjugate that are present in the conjugate pad will bind to the antibodies will bind to the SARS-CoV-2 will bind to the anti-SARS-CoV-2 antibodies that are present in the sample, and then in this testing well, here in this testing well, if these antibodies are present, it will bind to the gold COVID-19 antigen conjugate, and these antibodies, other part of the antibodies will bind to the anti-human IgG antibodies. So in this case, the testing site will light up because of the uh, fluorescence, or the this gold COVID-19 antigen conjugate has some fluorescence activity. Because of that, this testing line will light up. And at the same time, this conjugate pad also contain rabbit gold conjugate, and rabbit gold conjugate. So this antigen, so uh, I have said something differently. Okay. So what happens is that these antigen are from the sample, and these antibodies are present in the conjugate pad, and these antigen and antibodies are present in the conjugate pad. So if this antigen is present in the sample, it will form a conjugate in the conjugate pad, and then this it will bind to the antibodies, and then these antibodies can bind to this anti-human IgG IgM antibodies. And similar, if this COVID-19 antigen is present in the sample, this rabbit gold conjugate, this rabbit antibodies against this rabbit antibodies will also bind to this conjugate, and in the control well, what will happen is that there are anti-rabbit IgG antibodies, so it will bind the rabbit antibodies, other part of the rabbit antibodies, and this control well will also light up. Hmm. So in this case, when the how the result should be interpreted, if both the lines are light up, then it should be considered as positive. If only control well is light up, it is considered as negative. If the nothing is light up, it is considered as the instrument is not working properly. If only testing is light up, then also it is considered as instrument is not working properly. So here in the case that if let us understand this case, how this negative will occur. This rabbit gold conjugate, what it will does is, it is not necessary that it will only bind to SARS-CoV-2 antigen. It will bind to any antigen that is present in the patient's sample. So, and then it will bind to the anti-rabbit IgG antibodies. In this way, this control will always light up, or change in color in the control value will always show, regardless of the present of COVID-19 antigen conjugate. Whereas this one will also only light up when there is a COVID-19 antigen conjugate present. So this is how the serological diagnostic test for COVID-19 antibodies occur. So details of this assay can be present available in this reference paper. So that's all for this video. Thank you for your time.